Welcome to Be Well with MS podcast series, where I and expert guests discuss science and science-based tools for everyday life to preserve brain health and quality of life living with MS. I'm Dr. Agnes Trokjana, neurologist, researcher, innovator at Torbay and South Devon NHS Foundation Trust in the UK.
So today's guests are two, starting with Dr. Leonora Fisniku, who works as a consultant neurologist at Cambridge University Hospital's NHS Foundation Trust. She completed her undergraduate medical training at the University Mother Teresa in Tirana, Albania. Her postgraduate training took her to Scotland, France, and England. She traveled all around the world. She has completed her neurology training in London, working at National Hospital for Neurology and Neurosurgery, and Imperial College Healthcare NHS Trust, and King's College Hospital. She also contributed to research extensively, as she has completed her research training at the Institute of Neurology under supervision of Professor David Miller, and was awarded a PhD at the University of London with the title MRI Markers of Long-Term Disability in Relapse Onset MS Patients. The aim of this work was to assess the ever-challenging role of the MRI scan as a predictor of disability in MS patients on a unique cohort of patients followed up prospectively with a clinical MRI data every 5 years, from the disease onset with a clinical isolated syndrome up to 20 years. Results from this work have led to publications in Brain and Annals of Neurology and presentation at several conferences, as well as recognition, awards, and grants from the American Academy of Neurology, the European Committee for Treatment and Research in Multiple Sclerosis, the Association of British Neurologists, and Brain. The current interests lie on providing a holistic approach to the care of the MS patients, making the MRI scan a useful tool on management of MS patients and ensuring that MS treatment is something that every neurologist knows about. So hello and welcome to the show, Leonora.
Hello, and thank you very much for inviting me, Agnes.
Thank you. Another guest is Charlie. I met with Charlie in 2019. She became my co-lead of Healthy Lifestyle Workstream under Rising the Bar initiative led by Professor Gavin Giovannoni. She's a freelancer health writer, works for MS Academy, with a background in neurology informed by working alongside patients, clinicians, and the voluntary sector. Charlie's experience in this field has been broad. From event management and communications to research and service development, she has developed care pathways, mentored charities, and produced bespoke training packages. Whether speaking at educational events, authoring academic articles, or supporting course development, she's committed communicating and educating around health, wellness, and lifestyle. So hello and welcome to the show, Charlie.
Hi, it's fantastic to be here. Thank you for having me.
Thank you. So today we're going to talk a very interesting topic that we chose. That was initial sort of a thought to cover. The very, very important sleeping problems that people may develop living with multiple sclerosis. So I would like to welcome you both and open the discussion around the MS and sleeping issues and how to preserve the brain health. So my first question to you both is, what does that mean, brain health, to you as a person? If you could just take me through your morning or evening rituals, how does that look like? Maybe starting with Charlie, yourself.
Yeah, so brain health for me really means living each day being as emotionally, cognitively, and physically well as possible. And that means making certain choices, and each day maybe looks a bit different. Some days I manage a lot in this direction, some days less, but that's essentially it. It's that whole health picture, really. So I guess I'm a bit strict with my routines, really. I have some health challenges myself, and I know that my brain health is really important. So my mornings, I have a light box alarm to help me wake up a bit more naturally. I'm very fortunate I have that. I go for a walk within half an hour of waking. I always have a coffee in hand. And after my walk, which might be 20 minutes very slowly or an hour really fast, it depends on how I'm doing that day. I'll normally do maybe 10 or 20 minutes of yoga or strength training. When I get back, and then I have a cold shower, and that is my 1 hour for me. And then the rest of my day is for everybody else.
Charlie, have you noticed that the way you start the day is like it's setting the scene for how your day is going to be for the rest of the of the day, and how it's sort of going to evolve, with all the events that may happen at daytime, but your preparation, your mindset, your activity that you prepare your body as well as mind, and there is a mind and body connection, and that's how you sort of almost set the scene. Have you noticed that if you have a bad day, bad morning, that you rushed because you needed to do some school run, and you sort of everything just gone so messy, and then the whole day sort of feels exactly the same as you started. But when you take your time, you set up certain activities that is a bit slowing down, a bit of a taking time and enjoying the process and being mindful. So that already going to nourish and set the very positive mood. Have you noticed that?
Definitely. I mean, it took some time to get this in place. I've always walked, I've always done yoga, I've always had cold showers or gone cold water swimming. But it wasn't till last summer that I started to do it first thing in the morning. And of all the things that I've done to improve my health over the years, switching all these things to happening together and first thing and outside in nature, it seems to be like that little slip where everything's clicked together and had the most impact. So yeah, and the odd day where I miss it, I'm horrible. I'm stressy and irritable and snappish and just my worst version of myself. So yeah, absolutely. I've really noticed the difference.
It applies to everyone. I think we feel exactly the same. We can just, feel for each other. And there are days, good days and bad days. Exactly the same happens to our patients. You don't necessarily need to have MS to feel that way. But setting the scene from the early morning is something to go for. So, Leonora, I'm sure you have a very healthy routine when you wake up in the morning, you set yourself for, and what does that involve for you?
Well, thank you, Agna, for the questions. Well, my morning rituals very much depend on whether it is a working day or an off day. On my working days, my non-working days, I prefer to wake up with no alarm clocks. So I'd like to start my day with classical FM on. I love smooth classical music. I like to go to the garden and pay attention to the flowers. I like morning showers. And with the music on, I usually have a light breakfast, lots of berries and light Mediterranean breakfast. I like to pray and read still with the music on the background, and prefer to go for walks in the park nearby. And this is how my day starts.
Wow, wonderful, Leonora. I think you're describing a lot of mindful activities. You go out, you get sunshine exposure, you watch your surrounding and environment, you see the flowers blooming, and you have your coffee. I suspect within an hour since being awake, I guess, not earlier. We're going to discuss that later today, how to get ready your mind to get into a proper good quality of sleep. So thank you for sharing, Leonora. I'm sure that a lot of people are going to listen and follow your example. Nothing is better than waking up in the morning and going out and enjoying the cup of tea outside and getting a bit of a sunshine exposure if you live in a country where the sunshine. If not, still you get a lot of UV through the clouds. Is not the end of the world. And if you have some roof to cover from raining, so that's an amazing opportunity to start your day. So, as we know, today we're discussing about the sleeping issues and problems. Poor sleep has got a very negative impact on the physical, mental performance, immune system, how the wounds are being healed, how we look like, age-related memory decline. So, how we sleep deep and fall back to sleep if we are awake and sleep through the night, all night. Everything, all of these aspects are very, very important. And then there are some physiological body reactions before we go to sleep and then during the sleep and when we wake up. So there are some body temperature changes, such as increasing body temperature is the reason why we wake up in the first place. cortisol is being released, is one of the hormones in the early morning hours. The metabolism starts gaining the full capacity and function as during the nighttime it slows down. It enhances the whole immunity and improves the performance and wakefulness throughout the day. It's important to talk about this, I think, and probably it would be nice to go into a bit of the underlying architecture and physiology overall. And I think we need to know how it's all functioning in our bodies. What happens during this sleeping phase, and what are the phases, and what happens to people's bodies from the biology perspective. Leonora, would you just comment a little bit, just broadly, to understand what does that mean? What happens in our bodies when we fall asleep, or before falling asleep, or during the sleep?
Okay, well, thank you, Agna, for the question. So the sleep architecture refers to the exact cycles and stages of sleep a person experience. And there are 4 recognized stages of sleep. The first 3 stages of sleep, otherwise known as a non-REM sleep, otherwise known as N1, N2, and 3. And the 4th stage is what is described as REM sleep, or rapid eye movement sleep. So going through the stages briefly, the first stage of the sleep cycle, that is the non-REM stage 1, is the transition between wakefulness and sleep. If you waken someone during this stage, for example, they might report that they were not really asleep. So what happens during this first stage, our brain slows down, our heartbeat and eye movement slow down, and your breathing slows down a bit. Our body relaxes, and muscles may twitch during this time. The brief period of sleep lasts for around 5 to 10 minutes. At this time, the brain is still fairly active, and it is producing high amplitude theta waves, which are slow brain waves occurring mostly in the brain's frontal lobe. And then we enter the stage 2, which in this stage, people spend approximately 50% of their total sleep time, and the cycles last for about 20 minutes. And as we move from stage 1 to stage 2, we become less aware of our surroundings. Our body temperature drops, our eye movements stop, and breathing and heart rate becomes more regular. And the brain also begins to produce bursts of rapid rhythmic wave activity, which are known as sleep spindles. They are thought to be a feature of kind of memory consolidation, when our brain gathers and processes and filters new memory that we have acquired throughout the day. And while this is occurring, our body slows down in preparation for a deep stage of sleep, is non-REM sleep stage 3. And the deep sleep stage is when the brain and the body repair and restore and reset for the coming day. Then otherwise the stage 3 is known as delta sleep. Is a period of sleep where any noises or activity in the environment may fail to wake the sleeping person. And then going into non-REM stage 3, our muscles become relaxed, our blood pressure drops, our breathing slows down, and we progress into our deepest sleep. And during this deep stage, our body starts physical repairs. This is a really very important stage of sleep. At the same time, our brain consolidates declarative memories, for example, general knowledge or facts of statistics, personal experience, and other things that we might have learned. And then we enter on the final stage of sleep, which is called REM sleep, the 4th stage of sleep, when our voluntary muscles become immobilized. During this stage, our brain activity most closely resembles its activity during waking hours. However, our body is temporarily paralyzed, which is a good thing. Otherwise, we end up, acting our dreams. Under normal circumstances, in order for us to enter this REM sleep stage, would have been asleep for about 90 minutes. But as the night goes on, the REM stages get longer, especially in the second half of the night. And while the first REM stage might last only a few minutes, the later stages can last for around an hour. And in total, this REM stage sleep accounts for about 25% of sleeps in adults. So what happened during this time? Our brain lights up with activity, our body is relaxed and immobilized, our breathing is faster and irregular, our eyes move more rapidly, and it is because of this that the name of the stage comes from. and we dream. REM sleep is known for most vivid dreams, which is explained by the significant uptake in brain activity. Suffice to say, the dreams can occur in any sleep state, but are less common and intense on the non-REM sleep period. As we said, like stage 3 memory consolidation also happens during REM sleep. However, it is thought that this stage of the sleep is when emotions and emotional memories are processed and stored. When we think about the sleep stages, it is important to realize that sleep does not progress through 4 stages in a perfect sequence. When we have a full night of uninterrupted sleep, the stages progresses, sort of follows. They go from stage 1 to progresses to stage 2, and then stage 3, then back to stage 2, and finally on REM sleep, as I said, so the first stage occurs roughly about 90 minutes from that, from the start of the sleep. The time spent in each stage changes throughout the night, so the cycle repeats, and there are about 4 to 5 cycles in total. Importantly, there are several hormones and neurotransmitters that are involved in sleep cycles, such as melatonin, for example, which is otherwise known as sleep hormone, and it is produced by the pineal gland and is stimulated by darkness and is increased as we're about to fall asleep. It is the hormone that tells our body it is time to go to bed, it's time to sleep. And as the melatonin is increased, another hormone, cortisol, otherwise known as stress hormone, and produced by adrenal glands, is reduced. Stimulating our stress hormone can affect our sleep patterns. Levels of the hormone cortisol dip at bedtime and increase during the night, peaking just before waking. And this acts like a wake-up signal, turning on our appetite and energy, so to speak. As we wake up, the melatonin produced is reduced and the cortisol is increased. It is, in fact, the cortisol that makes us fully awake first thing in the morning. And a lot of hormones are regulated during the sleep, including hormones that are produced in the brain, such as melatonin that I mentioned, growth hormone, antidiuretic hormone, oxytocin and prolactin, as well as other hormones that are produced elsewhere in the body, insulin, cortisol, aldosterone, leptin. And there are several neurotransmitters, as I mentioned, that are involved in sleep, and one of them is adenosine, for example, which is an inhibitory neurotransmitter, meaning that it acts as a central nervous system depressant and inhibits many processes associated with wakefulness. And while awake, levels of adenosine in the brain rise each hour, and therefore it is believed to be responsible for increasing levels of sleepiness that develop the longer a person stays awake. And during wakefulness, adenosine levels gradually increase in areas of the brain that are important for promoting arousal, especially the reticular activating system in the brainstem. In fact, caffeine found in coffee, tea, and other caffeinated drinks works to inhibit sleep by blocking the action of adenosine within the brain, which increases wakefulness. So, in other words, when you drink coffee, or when you drink caffeine, it stimulating effects by blocking your brain's adenosine process.
How interesting is that, Leonora? Thanks for this very detailed summary. I think from my sort of experience, when I was a student, the best lecture I ever attended was related to sleeping disorder, and I was so fascinated how phenomenal our bodies are at nighttime. There is such a process going on from the physiology perspective, brainwave activities to physiology released hormones in our bodies. So it's really interesting fact to learn. And in general, we go through in a simple language, we go through the phases of sleeping, and there are 4 phases. And, before falling asleep, we are in one mode, and we sometimes kick our legs and jump in our bed because of the preparation of getting into sleep. And then we go into the very deep sleep, which is so interesting that our bodies gets paralyzed. We can't move apart from the eye movement. Eye movement is still preserved, and that's why it's called a REM sleep phase, right, Leonora? And then all these hormones are being released in our bodies that further helps to function, help us to be awake at daytime. And then almost what happens at nighttime, and what happens at daytime in particular, it helps us to prepare for the following night's sleep, which is again, we're going back to how you start the day really is impactful. What's going to happen at nighttime. So I just want to learn a little bit more. And Charlie, if you could take us a little bit, what are the sleeping problems living with MS, and is it prevalent or not? Should we be worried or not? And what are the reasons for that? And how does that affect people with MS?
Thank you. I think the first thing to say is let's not be worried, because worry makes us not sleep well. So I don't think we want to be worried, but I do think we want to be aware. So the relationship between MS and sleep is a little bit complex. For the one point, people with MS are more likely to experience sleep-related disorders, things like insomnia, sleep-related breathing disorders like sleep apnea. Restless legs is another really, really common one. And they're all going to interfere with your ability to either fall or stay asleep. And it's really important, if you're experiencing any of those, that you talk about it with a clinician, because there may be things that can be done, interventions put in place that can help to eliminate those or alleviate those so that your sleep isn't as impacted. But for me, the more complex side of MS and sleep is the interrelationship between other symptoms and sleep, and the way that sleep can make those symptoms worse, and the symptoms can make each other worse, which can stop your sleep. So, for example, if you have anxious thoughts leading towards bedtime, it's going to stop you being able to sleep. If you are experiencing pain, you maybe can't get comfy. If you are in a really strong period of fatigue, you may not be moving very much, may not even have a particularly clear mind during the day. But that means that come bedtime, maybe you're not tired, you're still fatigued, but maybe you're not tired. It might be that you have bladder problems, and that's causing you to wake regularly throughout the night, or worry about the waking during the night, which is stopping you from sleeping in the first place. So it can get quite complex. And I think things like low mood and depression are associated with sleep problems in and of themselves. So it might be that you have symptoms that are exacerbating other symptoms or exacerbating your sleep. And we all know that poor sleep can contribute to low mood and to feelings of pain and to fatigue. And actually, a study looked at a cohort of otherwise healthy people and sleep deprived them. And they found that within a couple of days, those people were reporting those same symptoms: fatigue and pain and cognitive impairment, and low mood and irritability. And so if these are prevalent within a healthy population, and they are common symptoms of MS, you can see how sleep would, or a lack of sleep would, exacerbate those. But what makes this a positive flip, I think, is that if you can break that vicious cycle of getting a poor night's sleep, which exacerbates your symptoms, which makes it a worse sleep the next night, and so on. If you can flip that, that means that a good night's sleep can conversely make you wake feeling slightly less fatigued, or with a better mood, which means your pain perception is perhaps different, which maybe means you feel more able to engage that day, which might give you a better night's sleep that night. And so that vicious cycle that can make things get worse can actually be reversed with very simple things to make things get better. And I'm really excited to talk about some of those things, actually, because I think making 1, 2, 3 changes over time can have a massive impact on the way people with MS experience a whole host of symptoms, and maybe can help them to address some of those sleep-related disorders as well.
People with MS, they have a lot of symptoms, and of course they get a lot of noise and disruption at nighttime. So have we got any evidence that people with MS have more prevalence having sleeping disorders versus normal population? Any evidence in this arena?
Yeah, so there was a study in 2019 by Foschi that looked at exactly that. And sleep-related disorders are a lot more common amongst people with MS than in the general populace. I think that there's also the awareness that because low mood is a symptom of MS and can also be associated with sleep problems like insomnia, it's not clear whether those sleep problems are of their own, or whether they're related to MS itself, or whether they're related to symptoms. But we do know that they are more prevalent, yes.
Okay, well, emotions, depression and anxiety is more prevalent living with MS than in contrast to normal population by 20%. So that probably resembles with a sleeping disorder, I'm sure. Right. Okay. So, Leonora, I would like to know a little bit around the anatomy. We know that people with MS, they developed white matter lesions in the brain. And I know that there is not necessarily a correlation between the white matter lesions within the brain and the symptoms that people present with. People may have more lesions and just a fewer symptoms, or some people have just a fewer lesions and they have multiple symptoms of MS. Do we know whether it's relevant to know the position, the location, anatomical location of the brain lesions that potentially disrupts the good quality of sleep? Do we have any evidence, and should we be concerned about this and look into more detail and depth?
I would echo the review that Charlie mentioned, that indeed there is evidence that sleep-related disorders are more commonly seen in patients with multiple sclerosis compared to the general population. And unfortunately, they do negatively affect the quality of life because they do cause more fatigue and more daytime drowsiness. So in order to identify what anatomical correlation we have or we see in MS, it is important to kind of recap on what kind of sleep disorders we see more commonly in patients with MS. And some of these sleep disorders that we see directly or indirectly linked are insomnia, sleep-related breathing disorders, restless leg syndrome, periodic limb movement disorders, and there have been case reports of secondary narcolepsy, REM sleep behavior disorders, and properspinal myoclonus. Now, insomnia is something that is seen very commonly in MS patients. It's usually secondary to other disabling symptoms that unfortunately quite a lot of our MS patients experience, such as nocturia or pain, or what you refer to anxiety and depression. However, more kind of sort of specific related sleep disorders, they do have anatomical correlation. For example, lesions in the pontine tegmentum and the dorsal medulla have been associated with sleep-related breathing disorders. Spinal cord lesions or atrophy are associated with restless leg syndrome. Narcolepsy-like symptoms are seen in patients that have bilateral lesions in the lateral hypothalamus. Lesions in the dorsal pontine tegmentum are related with REM sleep behavior disorders. And we've known for a long time that intramedullary demyelinating plaques in the spinal cord are related with properspinal myoclonus.
Right. Okay. So to explain that in a simple language, Leonora, correct me if I'm wrong. So basically, in the middle of the brain and at the back of the brain and the spinal cord, anatomically is involved into sleeping phases and the quality of sleep.
Absolutely.
Yeah. Right. Okay. So let's say half of our listeners now self-diagnosed with insomnia, I'm sure, or sleep apnea or restless legs now syndrome. I'm sure some of them Googled what does that mean. It's a kicking pattern in the legs, in particular presenting at rest time when you are in bed and you're just about to fall asleep. Your legs start jumping, moving involuntary, and then you stand up and you walk, and the symptoms improve. So that's a reflection of the restless legs. Sometimes people describe a bit of a tingling sensation, burning sensation, but again, it improves with the movement. The more you move, the better it is. So that's a restless leg syndrome. So I'm sure that listeners are now thinking what symptoms they have, can they relate to what we just described? And once you are diagnosed with a sleeping disorder, living with MS, the next step is how to help yourself. So what are the sleep toolkit for better sleeping? Are you aware of any suggestion, any recommendation would be much appreciated. So Leonora or Charlie, one of you, if you start telling us a bit of how should we help ourselves to sleep better, to feel better?
Sure. Well, I think good sleep, it starts in the morning, which seems counterproductive. but it really does start in the morning, and it starts with how you wake. And we know that increasing body temperature is what wakes us up. Leonora explained that that's kind of triggering your cortisol, which is your wake up hormone, your alertness hormone. And we know that conversely, a lower body temperature will help us feel sleepy and improve our sleep quality in that way. So if you are someone with MS, you might be experiencing actually temperature dysregulation. It can be something that isn't quite so stable in people with MS. And it might be that your body temperature isn't helping you wake up as much, or it might be that you want to give it a little bit of a boost. Or it might just be that you want to try and trigger a bit more feeling of awakefulness. And one of the ways that you can do that is that cold shower, actually. Another way is the exercise. And if you do both at once, that's not at the same time, obviously. But so with the cold shower, that will raise your core temperature by getting your skin, your largest organ, with all its cold receptors. It will get it really, really cold, which will make your body think, goodness me, I need to protect my organs, and all your blood will rush to your core and raise your core temperature. On top of that, actually, cold water, even for just 30 seconds, has been found to help your immune system. It might even help with some fatigue because it activates the mitochondria in your brown adipose fat. So there's loads of other reasons. And there's some great research from Susanna Soberg about that, actually, if you're interested. But you can also then exercise in any way you can manage, really, because that's also going to raise your body temperature. And in addition to then triggering that cortisol, which is wakeful, it's also going to release some adrenaline, some dopamine. So it's going to give you a bit of motivation to start your day, as well as those let's wake up hormones. And you can always stack your exercise a bit. You could go outside, so you're getting maybe that bright light that we need in the morning. Maybe you're getting some vitamin D. Maybe you have like a movement buddy. So you're getting some connection as well and helping your mood in that way. So there's ways that you can kind of stack all of it into maybe a 20-minute walk followed by a 30-second cold shower. And your sleep that night will thank you for it. The Johns Hopkins Center of Sleep actually say that 30 minutes of moderate exercise in the morning will guarantee you a better night's sleep that night than if you had not had that 30 minutes. So you could start today, start tomorrow, and experience that sleep improvement in the evening.
Wonderful. Such a practical advice, Charlie. I can't, I think if I follow what you just said, I'm sure that my sleep will improve, and I promise I will follow your recommendations. And I like the bits that you're going through the spectrum and looking at the angle of connection. You know, you don't need to do all these activities on your own. There are people struggling, millions of people struggling with a sleeping disorder. Just take the hand and go out and enjoy your time, because it's going to be the same positive effect on your mate, on your friend, on your spouse, or any other family members. So we all need that, no matter whether you live with MS or you don't. We all need a good quality of sleep for general health. So Leonora, anything to add that from your observations and your maybe practical aspects, anything to add in terms of the recommendations? What do you say to your patients when you see in a clinic?
I suppose one of the things to emphasize is education, patients' education. I suppose this podcast is part of that, because understanding what sleep architecture is, for example, and knowing that a lot of patients or a lot of normal people, they do wake up. So understanding that kind of sleep architecture is really very, very important. I suppose when we talk about the sleep issues, it is important that we include sleep discussion as part of our holistic care. There are a lot of do's and don'ts when it comes to kind of regulating our kind of sleep hygiene, if you like, and sticking to a regularity, tending to go to bed at a particular time and waking up at a regular time certainly, helps a lot. Having MS or not having MS, Charlie talked a lot about the influence of light and darkness, and sort of if we wake up, having that sunlight exposure as early as possible, 20 to 30 minutes, but equally at the timing of at the bedtime, avoiding lights and keeping our use of technology, laptops, computers, our phones to a minimum, so we make sure that so we don't overdo it by using or exposing ourselves to lights that keeps us awake. What we eat and when we eat is equally very important. For example, avoiding alcohol and caffeine at nighttime again will ensure that we have a good night's sleep. One thing that we very commonly address in our assessment of our patients is the medications that patients do take, because there are some medications that can affect the sleep, being as part of disease-modifying therapies or symptomatic treatment. One of the things that we address when we assess our patient regarding the sleep disorders is looking at their prescribed and non-prescribed medications that they take, because we do know that some of the medications can influence the sleep pattern, and that is really very, very important to address.
Well, Leonora, that's really comprehensive advice, and it's coming from you as neurologist. I think nothing can be more robust here, Leonora. I think overall, I'm trying to summarize what you just advised people. I think there are 4 critical periods within 24 hours. And as we discussed, the first period is the waking up early, getting exposure of the sunshine, exercise within a few hours from waking up, having cold shower, coffee in the morning, maybe within 3 hours from being awake. And then the second part is midday and afternoon. Be very mindful in terms of the consumption of the caffeine. If you feel like you need an extra cup of coffee, be just very mindful. Maybe limit yourself to 1, 2, or 3 cups of coffee, and that should be no later than 3 p.m. That day. And I think it's very important that if you feel like you need a nap to recover your energy, go for it. It's totally fine. It doesn't disrupt your ability to fall asleep. Just make sure that it's not too late in the day that you're having a nap, and it's not longer than 90 minutes of having a nap. And if you feel groggy after having a nap, maybe try not to have a nap. Then try to function as you can throughout the day without having a nap, because it may affect your quality of life. And if you can, and if you need to exercise late in the afternoon, make sure it's not too late in the day, because you need some time to prep your body for getting into sleep, and delaying your circadian and wanting to stay awake until late, it really disrupts, because imagine that you have to go through all these 4 phases that Leonora just described. So you require hours to get through these phases. So sometimes there are disorders that, you go very quickly from one phase to another, but that's another topic, and it's a disease, a primary sleeping disorder. So to give yourself time, make sure that you allow this time at nighttime, and you're not shortening your sleeping, because it's crucial. It's very important. It's gonna affect how you feel throughout the day. And of course, the third cycle is getting into maybe having a cup of tea in the sunset, communicating activities and exposure by the sunset. It affects your circadian, and circadian is how your brain distinguish whether it's a day or night, and the signals you're getting in the evening from the sunset, again, it preps your body for the night sleep. So we don't recommend any artificial lights. Dim your artificial lights from 10 p.m. until 4 a.m. because that's only going to be very helpful to help you to fall asleep. And if you are the person who's enjoying the hot baths and sauna, that increases your body temperature, and your body gets ready to cool it down. It sounds very strange, but the body temperature rises, so that the cooling process is the phase that we are getting into sleeping mode. So that's why it's very important making sure that your environment is cooler and cold, and you use certain mattresses. There are some pads on the mattresses to cool the temperature of your body. You can search and Google that information and find something that suits you. So that would be probably it in terms of the sleeping advice from three of us today. So Charlie, I would like to ask you a question. I'm sure you looked at the literature and the research around the importance of for people with MS to have a good quality of sleep, and why it is important. What is the impact of poor sleep on brain health?
Yeah, thank you so much. I think it's really important to bear this in mind, because especially if you're struggling to get on top of your sleep, it can feel like something to just give up on. And I think this hopefully will help to give people some impetus to just keep trying different things and adding new kind of tools into their morning and evening routine. So the first thing I think that's really important to say is that getting a good night's sleep is going to maximize the brain function that we have right now. It's going to prevent any further deterioration as far as possible. And it's going to go hand in hand with that repair work that your body needs to do across your whole immune system, your cells, your hormones, everything. So whatever level of brain health you have right now, sleep is going to help to keep it there for as long as possible. So I think that's the first really important thing. I think it's really important to highlight autophagy, which my children affectionately call the brain's toilet flush. Essentially, when we're sleeping, our brains sort of shrink down and our lymphatic system flushes through and around the outside of the brain and between that and the skull. And it clears away all the cells that have died, any neurotoxins, any faulty proteins. And if it doesn't flush, if you don't get a decent night's sleep regularly enough for autophagy to occur, then all of that waste product sort of stays in the brain and clogs it up. And there's really clear evidence that can cause cognitive decline and is one of the factors in developing dementia and Alzheimer's further down the line. So autophagy is important, and we need sleep to make that happen regularly. It's actually been considered by a recent study published last year that we need to investigate autophagy more as an intervention strategy for treating neurodegenerative disease. So it's not just kind of good for us. If you're living with a neurological condition, I think it's a really essential thing to be aiming for through your sleep. And I suppose the final reason is again, talking about symptom management, really. So thinking about how our pain sensitivity is heightened by sleep loss. And when we have heightened pain, that also then in turn will affect our mood and potentially our fatigue levels. We know that a poor night's sleep affects our cognition. And if you're experiencing cognitive impairment, that's potentially going to be worsened as well. And finally, in terms of that pain level, there is a study that suggests that managing sleep and anxiety can actually decrease people with MS's pain levels. So I think it's really, really clear that sleep isn't just important generally, it's particularly important if you're living with MS.
So almost like a sleeping effect on the brain is invisible, because a lot of these chemicals, physiological events that happens in our bodies are not visible, but it's essential and crucial. And I only have to add, Charlie, that autophagy in MS is a very new concept. We haven't got a robust evidence, but it's a lot of studies in Alzheimer's disease and neurodegenerative disease, as you mentioned. So just to be clear, but something to look out for and explore. And perhaps if you are a researcher and listening to our podcast, please do set a grant and start the process of setting a new study looking at the autophagy impact on MS brain health. And Leonora, I know that we are very short of time in our consultations with our patients. And should you recommend talking with patients about the sleeping behavior, sleeping problems, and is it an important factor to cover during our consultations?
Yes, absolutely. Sleep problems, as we already emphasized, are common in our MS patient, and they do affect the quality of life of our patient. And I see sleep as part of our holistic care we should provide for our patients. And we need to identify what type of sleep disturbance one is experiencing in order for us to be able to kind of guide them on how to manage those. And as I mentioned earlier on, some of our medicines that we prescribe can affect the sleep as well.
And what are they, Leonora? What are they? Can we class that in a group of medicine?
Well,
give us a bit of an example.
Yeah, I mean, there are some medications that we use for treatment of depression itself, and that can affect the architecture of sleep. There are some medications that we use for pain control and for spasticity, for example, and those medications can cause more drowsiness in a way. Some of our patients do use, for example, cannabis, which is some do use it as Sativex, the already licensed treatment, but some do use other compounds, and so cannabis that is so bought elsewhere, and we don't know what other components are on the sort of preparations that patients are buying, and whereas some patients do report the control of some of the MS symptoms, unfortunately, the cannabis use can disturb the architecture of sleep. And alcohol obviously is not a prescribed medication as such, but they are people that would take alcohol in the evening, for example, and the misconception that alcohol can help you with sleep. In fact, it just simply causes drowsiness or decreased levels of consciousness. But again, alcohol can cause a very disturbed architecture of sleep. And addressing all these issues with our patients is absolutely, very important. There are some information on the MS Trust, for example, that is updated regularly. I suppose one thing that perhaps we didn't talk today is, and one of the challenging questions that it is very difficult to disentangle is that coexistence of fatigue and sleep disturbance, and it is kind of sort of a topic that perhaps should very well be addressed in one of the kind of podcasts in the future.
Thank you, Leonora, for that. And I know that people do purchase the CBD and melatonin. Melatonin is available without a prescription in the USA. It's not available without a prescription in the UK. And I think the concern with regards to this supplement, melatonin in particular, that we don't know what concentration and dose we get when we buy the supplement. So it might be so harmful from the health perspective. So you really consider twice before you purchase your melatonin online or in the USA in one of the pharmacies. That you can do that without a prescription. So it's loads of evidence now is coming that the concentration of the actual melatonin within the supplements that you can buy is unclear. And CBD function, we prescribe Sativex for people with MS for spasticity management. Again, that could increase the wakefulness throughout the day, and it might be, again, very misleading. And I've read a bit of a paper and publication around the wakefulness, that it improves the wakefulness throughout the day if you're exposing yourself of CBD. So maybe if you have a fatigue and you can't sleep after taking CBD at nighttime, try CBD oil, which a lot of people with MS expose themselves. Maybe try at daytime because it may improve your wakefulness. That's my advice, because that's the emerging evidence that we have. And the last thing that I would like to talk about is maybe summarizing everything what we just discussed, and from your belief and observations that you've done over the last couple of years, is anything that you think is true from your observation to preserve the brain health and improve maybe sleeping quality, even though that you can't prove it at this time moment?
Sure. So can I just add with regard to melatonin, Agne, because I know that people with MS often don't make as much melatonin, and feel free to edit this out if you want to. But there's also a concern that if you take synthetic melatonin over time, your receptors can become kind of numb to it. And so when you are producing your own melatonin, your brain doesn't respond to that signal in the way that it should. So that's an additional concern regarding melatonin supplementation.
So we call this phenomenon augmentation, right, Leonora, when you get used to the certain concentration in the body. That is, it's similar like with diazepam medicine, that the more you expose yourself, the higher concentration you require because your body is so much used to, and it's like opioids, similar effect it has. So really challenging behaviors around exposing yourself with melatonin, because you may just not help yourself. You may just harm yourself more than anything. So it's a really important aspect to cover. Leonora, would you agree with that?
Yeah, I mean, I wouldn't consider myself an expert on the use and non-use of melatonin, and the evidence on use of melatonin in patients with MS needs to be further explored. However, there has been some data that suggests that high levels of melatonin can be beneficial for MS patients. There was this study from Argentina when they showed that the patients with high levels of melatonin, the severity of relapses was less, but more is needed in terms of research to explore this. So I don't personally recommend melatonin to patients with MS unless there has been clear evidence of any sleep disorders, and those are echoed by our sleep specialists.
Leonora, I totally agree with you, and I think I read somewhere that melatonin has got almost like antioxidant effect, and talking about MS and regenerative process and biohacking the aging process, maybe it plays the role, but it's not evidence-based. We have limited evidence in this area, so it's too early for us to discuss in a very robust way. So we're just making some assumptions. So moving on, I think it's important to understand things in this life, and we quite often are limited with information, and sometimes we're lacking some evidence-based info to prove the point. So my question is, what do you believe is true from observation to preserve brain health, even though that you can't prove it at this stage?
I'm going to go with connection on that one, because we know that loneliness can be a risk factor for dementia. So there's clearly some interrelationship between cognitive function and our state of loneliness or connection. I think that finding connection to others, to nature, to yourself, it's quite a broad concept, but it tends to help us find meaning. And I think when we feel that we are connected and we have meaning in our lives, it helps our mood, it helps our sense of self, it helps our quality of life. And I'm quite confident actually that we're going to find more and more that the emotional relationships that we have with others, the connection that we form, is intrinsically tied to our brain health.
That's so beautiful. Thanks for that, Charlie. Leonora, what is your insight?
Wow, this question is very thought-provoking. Well, I do believe that spirituality is something that is like a healing tool that we as physicians do not exercise so fully. And sometimes we are kind of shy of even bringing the subject with our patients. And I would have wished that there was a platform where our patients and the clinicians would be free to discuss this and to create a better platform for patients to talk openly about the spirituality that is, I think, a really very healthy element of our life that sometimes is missing from our daily clinical practice.
But it plays a huge role in our lives, I believe so. All the high performers in this world, we're looking at the champions and athletes and CEOs that achieved in this life. Part of their living spirituality is there, basically. That's how they managed to to build the resilience, to escape various different stressful situations, and to be sane, to feel sane. Given the environment that we live at the moment, we really need to build up that sort of a bubble that I say to my patients and my colleagues when they feel overwhelmed and feel like they're just going to break down. I say, look, there's a lot of noise in this world, and you really need to create your own world. Live in that bubble. Yes, you will be pulled to one side, another side, but if you create the wall, sometimes it's required. I'm not saying that you should shut the doors and windows and just stay on your own and live in isolation, because it has got a negative effect on your brain health and quality of life if you live in isolation, as Charlie just mentioned. But having that sort of a healthy living approach and making sure that you're not distracted by so many noises and signals and signs in this world is something to really reflect and consider. So the very last question. So we have a trend to ask questions each other, and the previous guest that I had asked questions and asked before, and now it's a time to ask your question to the following guest. So what would be your the question that you would like to ask? I'm not going to tell you who the following guest is, just to keep the intrigue going, but anything related to the brain health and multiple sclerosis, that would be much appreciated.
I had to think about this, and I think my question is quite a general one. I'd like to know their thoughts on how we can encourage a broader understanding and acceptance of the importance of brain health and lifestyle within that, in both people who are living with a health condition, but also within the healthcare professionals supporting them as well. I think it's increasing. I think the awareness is increasing. But I still think it feels like a small pocket, perhaps, of people who are really grasping this. So I'd be interested in their thoughts on how we make it more mainstream, I suppose.
Wonderful. Leonora, do you agree with this question?
Yes, yeah, very, very interesting question. Absolutely, yeah. So I'll take that.
Now it's a time for you guys to answer the question that comes from Dr. Andrea Stennett. She's a neuro rehab specialist, and she asks about how do you address the importance of exercises in your clinics, perhaps for you, Leonora, and Charlie, for you, how do you address the importance of exercises via MS Academy?
Well, thank you, Agna, for asking the question, and thank you to Andrea for posing this question. I suppose one of the things that we usually address when we see the patient is concentrating or addressing what things they generally enjoy. And in order for us to do that, it is important to create that bond and that trust between our patients. I must confess that our MS nurses colleagues do this much better than we do as doctors. Sometimes they visit the patients in their own environment, and that helps a lot. I think for me, inquiring on what patients enjoy most in their daily life, and as their disease progresses, inquiring what things they want to preserve and how can they readjust, their daily life, or so restructure their exercises, helps more in encouraging them to do, different type of exercises, or, so readjusting their lifestyle in such a way that they can continue to do things that they enjoy. I remember a patient of mine that enjoyed exercise and wanted to engage in a lot of sports, but unfortunately, as the disability set in, it became difficult for that patient to do the activities that he usually wanted to do. But then he looked at other activities such as wheelchair basketball, and it is interesting that sort of people find ways of adjusting and keeping that enjoyment so going. I think referring to resources that are available in the MS Trust and MS Society, very well kind of filtered resources, and MS Academy is always something that is always very helpful.
Wonderful. So, Charlie, I know that you work so hard to promote the wellness and healthy lifestyle on MS Academy initiative and program. Tell us a bit of a background and behind the scenes, what is going on?
Well, I think it's important to remember that our audience here is aimed perhaps at people living with MS, whereas the MS Academy's audience is aimed at predominantly healthcare professionals. And so the style of information being shared is maybe a little bit different. But in terms of kind of this question from Andrea around exercise, I think it's about helping healthcare professionals to understand what the evidence base is, to understand what the kind of the best aim is. I know that the 30 minutes of moderate aerobic exercise was definitely put out last year regarding MS and helping to manage fatigue, which doesn't always seem to make sense. But actually, if you can work up to it, starting small, it can be really amazing. But I think it's about breaking that evidence base down in a way that then clinicians can use it to engage their patients. Because what Andrea is asking is as how you get around people who are maybe less engaged in that information. And I think that's a really important part of sharing that evidence base in the first place. So if you can say, this is the gold standard, our 30 minutes of moderate exercise, but then you can explain that somebody seeing that or being told that might feel so overwhelmed that they won't do anything at all. So here are some starting points, encouraging somebody to stretch a little bit of yoga stretch in their bed before they get up, or maybe to park a little bit further away from the shop so they're walking a couple of more minutes, and helping to break that down so that then you're encouraging them once maybe that's a bit more comfortable most days, maybe park a bit further, or maybe try and go out for a 10-minute walk independently. And it's that incremental change so that maybe in a year, if their symptoms haven't worsened, maybe that goal of 30 minutes doesn't seem as insurmountable anymore. And conversely, like Leonora says, if suddenly that goal is not achievable, then modifying it so it's still something that can be attainable, rather than presenting something that is a long way in the future for that individual, that then means that they don't want to engage with it at all. So yeah, I think it's contrasting that evidence base with the reality of people's experiences. So you're encouraging something which is absolutely better than nothing.
Well, I do appreciate for that explanation. And I think Andrea is going to be grateful and thankful to know and learn how does that work in a real life. So today we discussed about this sleeping disorder, living with multiple sclerosis. And initially we discussed, and Leonora took us through the sleep architecture and physiology and all the phases involved into sleeping. Charlie covered about the common problems, sleeping problems that are prevalent in multiple sclerosis. And we know and we learned that sleeping problems are more prevalent than in contrast to healthy population. We talked about anatomy, neuroanatomy and location, and how does that disrupt the quality of sleep. And we also, very important aspect and recording today was about the sleep toolkit, which we provided a lot of practical advice, how to improve their sleeping quality throughout the night, how to fall asleep and maintain the sleepiness throughout the night, and how to wake up feeling fresh, relaxed and nourished, and all the critical periods within 24 hours been covered during this recording. We also talked about the medicine and supplements that could be implemented to help to fall asleep, although we haven't got to robust evidences yet, but it's worth talking. So thank you both very much for attending and providing your insight and knowledge. I learned a lot, and I'm hoping to get a good night's sleep tonight, and I'm sure that all the listeners will have the same feelings after listening to this podcast. Thank you so much for your input.
Thank you so much for having me.
Thank you.